Good evening, everybody. You're joining IMED, and we're going to talk about something of an educational program. We're going to talk to Dr. Manil Kusumanatillaka, who is a consultant endocrinologist of National Hospital of Sri Lanka, who is also the president of the Sri Lanka Diabetes Federation and also vice president of Sri Lanka's Medical Association. Good evening to you, doctor.
Good evening.
I think we've spoken about in the previous episodes with regards to diabetes and obesity and all of that, but I think it's important for us to enlighten the audience what endocrinology is all about, and it's a lot to do with relating to endocrine system and hormones, but there are not just these two, there's a lot more that goes into it. If you could explain to us as to what this is about.
So endocrinology is a specialty which deals with hormones. Hormones is a chemical substance. A hormone is a chemical substance which is produced by what you call as a gland in one place of the body, and it goes in the blood and acts in a different area of the body, which controls the whole body metabolism and lots of other functions. They work through attaching to what you call as receptors in this thing. It's very specific. One hormone is produced in the brain, the pituitary gland. It goes and acts only in your either the thyroid gland or only in your gonads or the other organs concerned. This is through this specific receptor. So it's a very sort of a sophisticated control and a communication mechanism the body is having. So the commonest disease associated with the hormonal derangement in Sri Lanka and in the world is diabetes. That's the hormone produced by the pancreas, insulin. Then as shown in this cartoon, you can see I have put the different glands. On the main master gland which controls all the other glands in the body is called the pituitary gland, which produces about 6 to 7 hormones. I will tell more details about that. Then we have the thyroid, and behind the thyroid we have the parathyroid, which controls your calcium levels. Thyroid, everybody knows, thyroxine, which controls many functions in your body. Then you have your adrenal glands on top of the kidneys, which produces several hormones which has different functions in the body. And then you have your gonads, as you know, the testosterone and estrogens and the sex hormones, what we call. So these things control different functions in the body. We'll go through one by one as we go on.
And doctor, you mentioned about the main glands, because this is all about glands in the end, and that's a speciality that you have done, and I think a lot of it in Sri Lanka, not just in Sri Lanka, across the globe, talk about all of these diseases, but mainly it's to do with diabetes and obesity, and people talk about thyroid also. But there are many other diseases also. If you could explain to us about thyroid, for instance.
Yes. So any gland per se, all these glands I mentioned and the hormones, they can be underactive or overactive. So there will be different disease entities that are recognized and treated for underactivity and overactivity, right? So if you take the thyroid, as this cartoon shows, you have an underactive thyroid gland which is called as hypothyroidism. It's a very simple term. So where you are having increased daytime sleepiness, you are gaining weight, you are constipated, you have dry skin, you have lethargy, and you don't tolerate the cold well, you feel cold sometimes, and so many other symptoms as shown in the cartoon here. So that's underactive thyroid gland. So it's a very simple, if underactive, we give the thyroxine hormone to them. So then as you can see here, when you treat with thyroxine, what a change it makes. The patient's face look puffy, they are puffed up and they gain weight, and after treatment few months you can see the difference. Then the other side of the coin will be the overactive gland. The thyroid gland, we call it as hyperthyroidism, overactive thyroid gland. It's the other end. People lose weight, they become jittery, they lose their temper sometimes, they find it difficult to sleep, they increase sweating, they feel hot all the time, even in a cold climate they feel hot, right? and you might have loose stools and lots of other symptoms, and your heart will be, you get palpitations, the heart will be beating fast. So that is called thyrotoxicosis or hyperthyroidism. Then some people might have changes in your eyes, variety, different type of hyperthyroidism. There are different subtypes, but the one common type is what we call as the Graves' disease. You have seen people with staring sort of eyes happening, the eyes sort of bulge out. So that also is a type of thyroid problem which is called Graves' disease. So these are the common things which can be given by a drug which controls the thyroid hormones. If that fails, we give what we call as radioactive iodine to burn the thyroid gland which is overacting, and if everything fails, then we take the gland out. So basically, in a nutshell, that those are the common thyroid problems we see. But of course, there are enlargement of the gland, nodules, cancers in that there. But these are the two main disease entities: the overactive and the underactive thyroid gland.
And I think one very important message Doctor said is that it's treatable. That is something that a lot of people needs to keep in mind, because this enlarged glands and all that is something a lot of people been afraid of over the years, that whether it could be something that gets from a person to a person and that kind of thing. It's genetic for sure, but it doesn't definitely not is something someone else would just because they associate someone, there absolutely no contraction.
There are genetic elements or component is higher than for other diseases, for some of these rare diseases, but it doesn't, certainly not, it doesn't contract, or it might run in families, some of these rare diseases, but most of the time we see it happens spontaneously in people.
And Doctor, now you mentioned about the thyroid. What other complications do we have?
Okay, so let's start with the master gland, the pituitary, which produces and controls other glands. Another common when it comes to endocrine, but these are 1 in a million cases. Maybe we see about 20-30 patients in Sri Lanka, is what we call as Cushing's syndrome. So people should know the hormone called cortisol, which is produced by your adrenal glands, which I show with a small gland, triangular gland on top of your kidneys, which is produced by that and controlled by your pituitary gland, called a hormone called ACTH, which drives that gland to this thing. Any problem or a growth in the pituitary gland or the adrenal gland can cause this syndrome called as Cushing's syndrome. This is, people gain weight with this, and they become, the face become roundish, and they become what we call as plethoric, flushed appearance is there. As you can see in this slide, this young boy, you can see over the years how he has gained weight. So he has Cushing's syndrome, but people might think he has overeaten and now he's gaining weight. And this lady, we say ultimately you are like a lemon on stick appearance. There's central obesity, abdomen, everything is big, and your limbs become very thin. That's the characteristic feature of this syndrome. And there are bleeding patches sometimes, and then you get stretch marks on your tummy as shown in here, and there is increased pigmentation of the skin and the mouth sometimes. So this is what you call as Cushing syndrome due to the increase in the cortisol hormone produced by the adrenal gland. That's one thing. Then if you take another hormone, there is a hormone called growth hormone, which controls your growth during your childhood, puberty, and later in life also it has functions. So sometimes the pituitary gland, the growth hormone doesn't come out in the proper quantities, it's underactive. So then you get what you call as dwarfism. You have seen very short people, these days it's recognized and growth hormone is available. Mind you, all these hormones can be either controlled or given. So we are very lucky. If you lack growth hormone, and if we won't let a child be like this, we give the growth hormone in our clinics free of charge, which costs about 50,000 rupees a month, but still it's available and people grow, right? On the other hand, if the growth hormone level is very high, in adulthood suddenly the gland becomes overactive and the growth hormone levels go up. Then we get a condition called what we call as acromegaly. So this popular figure, if you remember, he also looks like that, and you get, you know, you don't grow tall, but you go sideways. Your arms, the palms and the hands and feet become large. Your shoe sizes change even after 18 years. There is separation of your teeth, your, you know, jaw becomes prominent, and the forehead becomes prominent. That sort of a thing which we call as acromegaly. That is increase in growth hormone in adulthood. So that's another disease entity, rare. Mind you, these are all 1 in a million or 1 to 2 per million incidents we are talking about. Then on the other hand, if your growth hormone level has been very high even when you are a young teenager before reaching puberty, you become giants. That is called gigantism, right? So this is the, I think, the tallest man who ever lived, 8'11" or something. But so these are most of these people have overactive growth hormone since childhood. That's why they went to that level. Then there are other conditions where there is a hormone called prolactin, which is the hormone which is controlling the milk production in nursing mothers, but it can on its own go up due to a growth in your pituitary gland. Then without any reason, people get headaches and they start producing milk without being pregnant or nursing a baby, in either males or females. So that is called a prolactinoma. We can either operate, there are medication to actually medically treat that, and you can shrink the tumor, or if it fails, people might operate, and there are other methods. So like that, there are so many hormones that either increase or decrease, and certain hormones, the adrenals produce the hormones called aldosterone and the adrenaline, noradrenaline, which are sometimes bit dangerous. It causes secondary hypertension. About 10% of the people who are less than 40, if you get hypertension, may be due to a hormone reason. It can be increased aldosterone, which is produced by the adrenal gland, or even Cushing's, acromegaly, the other syndromes. All these syndromes will increase your blood pressure. Your sugar levels go up. So these are the rare causes of high blood sugar, high blood pressure, and all that. That's the importance. So you have to catch these people and treat them for, you know, it has to be done in a specialized center. There are specialized tests and expensive hormone tests which needs to be done to diagnose, and most of the time you need MRI scans and different scans to image the glands, the pituitary and the adrenal glands. But this is all been recognized and treated in Sri Lanka. So this is what the specialty of endocrinology is all about.
And doctor, what you mentioned is that this is not life-threatening if you go and get the needed medical advice at the right time.
Yes, it can be. All this is life-threatening if you neglect it. I mean, they can't go on forever like this. You can see the changes that's happening. They will die at a young age if it goes unrecognized. So that's the idea and importance of programs like this, to educate the public, not to be suspicious of every feature like that, but you know, generally if you know that there are hormone diseases like this and there are abnormalities like the photos I showed, and you know, rapid weight gain suddenly for no reason at all, could be Cushing's. You know, the change in your hand sizes and the, you know, change in you know, sometimes the hat sizes, or your ring has to be replaced, or the shoe size changes. Think about acromegaly, right? So, and your pressure goes up for no reason at all, or in a young patient, think about what you call as primary hyperaldosteronism, which is about 10% now of the hypertensive population. So you have to do what you call as aldosterone renin, you know, hormone test, right? So likewise, if you are educated, then people will, you know, seek medical advice when you see people, you know, symptoms like this.
And doctor, you mentioned about Cushing syndrome. There is Addison's disease also.
Very
that
good.
is the other way around.
Yes, that's the other way around, which I didn't show here in the interest of time. But that's a low cortisol. That's also life-threatening. People just fall. If you are faintish for, you know, all the time, and you feel vomitish, there's abdominal pain, or with a simple fever even you are really down. So cortisol is one of the stress hormones, right? So you can't sort of tackle stress when the hormone levels are low, right? So that's the Addison's disease, and there is increased pigmentation. If your complexion has changed for no other reason, if you have gone in the sun or sunbathing, that's a different story. But without anything, your buccal mucosa, your palms and the lips are becoming darker, and you feel faintish, and you feel nauseous sometimes, and then even a slight viral fever will knock you down. You can't get up. That means you have to suspect things like Addison's. Very good that you brought that up. I didn't have a photograph here, but it's just pigmentation that you see. There's nothing major to show. It's very subtle changes, but when you get up, sometimes you might feel dizzy, what we call as postural dizziness. Your pressure drops when you get up, when you lack that hormone. So it's very simple. We diagnose, we give an injection and check the hormone levels, and we replace with hydrocortisone. Simple tablet, 2 to 3 times a day will solve the problem. So the famous person who had that disease was President Kennedy.
And Dr. Now you mentioned about certain things that a lot of people would have probably seen in certain individuals somewhere down the line, as you clearly mentioned about Shrek, the cartoon character, someone who actually lived. There was an original Shrek in the world, and these giants and all of that. But are there any rarer diseases that these glands come out with, or endocrinologists treat?
Yes, there are pheochromocytomas where there is catecholamine, the adrenaline and noradrenaline is produced in vast quantities. They get this episodes of palpitations, flushing, and the pressure shoots up suddenly to very high levels. So those are things sometimes. Then we have what you call as neuroendocrine tumors. These are called carcinoids sometimes. You get flushing, diarrhea, wheezing and things like that. So it involves the bowel sometimes. It can come in the pancreas. And mind you, we were talking about diabetes. We have the opposite of that. It's a very rare tumor called insulinoma. It's the pancreas suddenly forms overgrowth and produces insulin more than that's required. So people get low sugars. They are found unconscious sometimes. They have to eat throughout the night to keep their sugar levels up, the real opposite of diabetes. So that is called insulinoma. Those are all rare, very rare conditions that we encounter these days. Now that we are, we look for these things, we are increasingly finding in our population as well.
And is it a lot to do with people being more aware of what things are, how things could go wrong, and understanding certain symptoms of changes in certain people, or what is it that leads to these things, Doctor?
Yes, so these things would have been there, and unfortunately before the doctors became aware and the specialty became popular, people wouldn't have diagnosed these things. So there is a increased tendency now. Our specialty, although it's a relatively new specialty in Sri Lanka, we have started in 2003. We have over 40 doctors now spread through in all the provinces. All the major hospitals are covered by our colleagues, so they have the facilities, they diagnose, and the other doctors also are more sort of educated about these rare diseases through, we do lots of teaching through our college. So I think it's recognized more now, and people are also aware about it. So programs like this should educate more, and then if they happen to have these symptoms, they should present to your nearest hospital to get the proper advice.
And beyond these things that we have spoken about, Doctor, we have spoken about in particular about obesity and diabetes and thyroid, but there are other glands that could get affected, and what are those?
Then it's your gonads, testicles and the ovaries, which has its own this thing what you call as hypogonadism. So if it is a male, you can be under virilized or less male features. They might have less body hair and breast development in males, and they might be impotent or they might have erectile dysfunction, sexual difficulties, and fertility issues, and so these are rarer things what we call as hypogonadism, males or females. And on the other side, sometimes you can see it's a more common thing, what we call as polycystic ovarian syndrome. That is a common thing in young females especially. This is also again associated with obesity. You can see the dark color there, which we call as acanthosis nigricans. The skin has become thickened. They are insulin resistant, and they have a thing called IGF-1 hormone levels are high, and the thin becomes thickened like that. And then their ovaries start producing more male hormones, and they become what you call increased hair growth in their face, sometimes the chest and the body, and their fertility also goes down. There are problems with their periods, irregular. So this is a common condition associated with, again, obesity most of the time. So these are the other, this is not very rare, this is a very common thing. After thyroid disorders, I think this polycystic ovarian syndrome or the PCOS is the commonest, I think.
And how often do we get patients, doctor, and how do we treat it?
Lifestyle change. On a daily basis in our clinics, we see this condition. So it's again losing that 10% of your body weight or even little bit more, and we give medication like metformin to reduce your insulin resistance, or there are other medications, and then there are drugs to block these male hormone, excessive levels of male hormone. To block that, we have medication. So it's can be treated. Then to regularize your periods, we give cyclical hormones. By all these methods, they can be treated, but the best treatment would be again striving to achieve a ideal body weight, because this is also associated with obesity most of the time.
All right, doctor, thank you very much. Got to thank Dr. Manilka for sharing that information. I think that's a lot of information that we have shared with regards to what endocrinology is all about. I think, as doctor said, it's something of a specialty that's come up in Sri Lanka over the last 2 decades. As he said, 2003 when it started, and there are 40 specialists
at the moment, and about another 20 in training.
Wow. So the good news is that it's definitely treatable as long as you get medical advice at the right time. So that's for everyone to keep in mind. If you see any of these symptoms, please consult a doctor and ask for their opinion, and they will definitely channel you to the relevant doctor or the consultant of the district or province to take care of it. And we've run through quite a lot of rare diseases, not just the main ones that we spoke before in the programs with regards to diabetes and obesity. So whilst thanking Dr. Manilka Samanatilaka for sharing his expertise, I would like to say, make sure, as doctor said, stick to your diets and try and live healthy, healthier lifestyle, something that we need to change ourselves. Keep it in mind that there are certain things we need to change in order to make sure that we have a healthier and happier life. So something to keep in mind as I say goodbyes on today's edition. See you same time, same place next week as well. It's bye-bye from me.